The report says more babies are being born by C-section.
In fact, we're seeing the highest rate of C-section births in the past 20 years. Meg Shaw looking into this for us and talking with a local doctor who says the clinic is working to reverse this trend.
Yeah, Katie and Terrence, the numbers are so high right now. It shows that 1 in 3 babies in the U.S. are being born by cesarean section. But the Cleveland Clinic, they're trying to stray away from that if they can.
Libby Buckley, a dentist in Berea, is a mom of 2, giving birth to both of her kids by C-section.
My kids just wanted to stay in me forever. Yeah.
Her son was an emergency surgery. The surgery itself went well, but her recovery afterwards was rocky.
I was shaking a lot. Then they gave me my son, and I didn't, I was scared. I didn't want to hold him. I was afraid I was going to drop him. I was kind of freaking out a little bit.
So when she was pregnant with her daughter, she wanted to try to give birth naturally.
I didn't want to pick out the date of my, child's birth.
But naturally, her daughter was a week past due, leading to another C-section. Libby's story is just like so many others across the U.S.
Really, over the last couple decades, we've seen a progressive rise.
Dr. SELENA ZANOTTI has been an OB for the last 20 years. She says cesareans are not only health burdens, but medical and economical burdens.
A healthy woman having 1 C-section is probably a low risk. But the concern is when a woman has a 2nd C-section or a 3rd C-section, there's risks of some devastating complications from those.
Dr. ZANOTTI says the alarming rise is now getting the attention of national agencies like the American College of OBGYN, who just updated their committee opinion about cesarean deliveries, advising that a natural birth is safe and recommended if there are no risks to mom or baby. Dr. ZANOTTI also tells me more hospitals like the Cleveland Clinic are working towards lowering their C-section rates.
C-sections are needed. C-sections definitely are indicated in a lot of medical conditions, but we just need to be cautious on how many we're doing them.
And new numbers show that last year the Cleveland Clinic had a 22% rate of cesarean sections for first-time moms, which is a big improvement in recent years, and the clinic actually wants to work to lower that number even more. Live in Cleveland, Meg Shaw, News 5.